Unethical motives for pharmaceutical companies and health insurance companies. What am I talking about? So for a for-profit company, their motive is to make money, right? So for a pharmaceutical company, they make drugs, they make medicine to help people that are sick. So the more medicine people buy and the more medicine people take, the more money they make. The more expensive medicine is, the more money they make. So when it boils down to it, the profit motive of a pharmaceutical company is that people are sick so that they can give them medicine. That's why you see a buttload of pharmaceutical commercials on TV, which is kind of surreal in other countries, that there would be medicine advertised on TV. Normally a doctor just knows what would work best and that's what they prescribe. So you've got the pharmaceutical industry motivated by people being sick. Then you have the health insurance industry. They make money when people don't get sick and don't need treatment, right? If somebody does get sick, it's in the financial interest of the insurance company to not pay for that. So they're incentivized financially to not provide treatment. So you can kind of start to see why there's a problem here. You've got the pharmaceutical industry who doesn't want, but they're fine with people being sick. And then you have the health insurance company that doesn't want to treat sick people. Most people in America eventually run into some health issues that cause them significant sums of money. And navigating these industries is very difficult. They might go, well, my health insurance company won't pay for this thing that I obviously need help for and that they obviously should cover. And then even when they do, the medicine is so expensive that there's just no way to realistically cover it. I mean, if you have something like AIDS or HIV, I mean, it might cost hundreds of thousands of dollars a year to treat. I mean, how many people can seriously afford that? Almost nobody. Even just for ridiculous minor things. I mean, I have insurance. I got pink eye several months ago. I go to the doctor. I know what it is. I just need to get a prescription from him. Even with insurance, the doctor visit was over $100. And then the prescription, which I take for several days, it's like a 70-year-old type of medicine, cost over $70, I think. I mean, that's a lot of money. Fortunately, I had that money and could pay to get that treated, but that's a pretty minor medical issue and a lot of money. And I just don't understand why that's the case. I mean, other countries are able to produce medicines for much cheaper. They're allowed to deal in generics much easier. I don't understand why we can't just import medicine from other countries like we import virtually everything else. Watches, computers, TVs, food, everything but medicine, it seems. I think these two industries have kind of a stranglehold on Congress where it's very easy to donate to campaigns. It's very easy to get members of Congress to vote in the interest of those two companies. Let's crush Obamacare, which is kind of a weird dynamic because it forces people to buy health insurance from health insurance companies. But that also means that health insurance companies have got to cover people with pre-existing conditions. They can't just kick people off because of ridiculous reasons like spelling errors on the application forms. But anyway, these two industries, I think, have unethical motives. I personally think at least the health insurance industry, which essentially does nothing to help people get better, they're just kind of the middleman in the whole process. I personally think they just shouldn't exist. Or at the very, very least, there needs to be a public option, meaning, yeah, you can pick from one of these for-profit companies for your health insurance, but we also have this non-profit government-run option. If you don't want it, you don't have to take it, but it's there for you. And since it's non-profit, it would kind of by definition be substantially cheaper. The administrative costs of the average health insurance company is 25%. What that means is 25% to run the whole show and to pay profits out. Whereas Medicaid, which is already government-run healthcare, I believe has an overhead of more like 2 to 3%. So there's a lot less money being what I would call wasted, lining the pockets of people that already have tons of money. So I think at least a public option makes the most sense because there's just too much unethical motivation for a health insurance company. And in my opinion, ideally, we just wouldn't have them. It's just, yeah, the whole shebang is nonprofit and everyone's a part of it. I think the government would have much more bargaining power to say, you know what, EpiPens aren't going to cost 400% more. We're just not going to allow it. And I mean, the health of your citizens should not be up for sale. I think it's, again, just one of those industries that just can't be for profit. I understand that there's a lot of people employed in it. They could still be employed in it under a government-run healthcare plan. But, I mean, we're talking about people's lives. People are getting sick and can't get treated. People are dying. Kids are getting sick. Kids are, they're born with diseases and families can't pay to treat them. I mean, this is crazy. What is the benefit of a federal government and a country that, we all band together to join together to get services that people on an individual level couldn't buy? What's the point if we can't even live? I mean, it just seems, why wouldn't we at least want our citizenry to be healthy? It seems very basic. I see really no other way around it other than eventually going to a single payer government-run system. It rubs a lot of people the wrong way, but I think it's essentially inevitable. Whether it takes 5 years or 50 years, I just don't know how it can keep up the way it is with premiums doubling every year just because health insurance companies want to make double the money. I think it would be wise to call your member of Congress, your senator, whoever, and say, yeah, I'm done with this health insurance bullcrap. Like, let's just get on board with a single payer system and let's move on.